Okay, so our next question is from Claire Hastie about long-term. So I think this is very linked to Michael Rosen's question about long COVID and who was hospitalized. Over to you.
Thank you. I started the long COVID support group on Facebook, which has almost 23,000 members. And I want to call for your help, please, in helping us to get long COVID into the dialogue. One of the key reasons I think it's not spoken about enough is that it's not measured, as has been touched upon earlier. We need to move the narrative away from deaths, cases, positive cases. Many of us fell ill in March before testing was available. Testing is now difficult to access as well. And I also want to emphasise that help needs to be given urgently for the vast numbers who were not hospitalised. So many of us might have gone to A&E multiple times and been practically crawling through the door, but because we didn't hit a certain threshold with our SAT levels or whatever it was, we were sent and left to languish at home. And several studies now are demonstrating that those of us who are not hospitalised are seeing symptoms of a severity, duration and breadth. In some cases more than those who were hospitalised, even those on ventilators. So the government investment in the FOST COVID study is welcome, but it focuses on hospitalised patients. The Your Recovery website is welcome, but we need face-to-face investigations in multidisciplinary clinics to rule out some of the organ damage that we know from research affects those of us who are not hospitalised as well. We cannot be given websites to tell us to exercise and give us rehab until we've ruled out myocarditis, pulmonary embolisms, all of these other risk factors. So we need your help, please.
Thanks, Claire. That's such an excellent point. Does anyone want to respond? Martin, yes.
Well, just first of all, thank you for everything that you're doing in raising visibility yourself. I can assure you that both through Independent Sage, we will be doing it, and many of us in our own individual capacity. As I said, I'm convening a group for the European Regional Office of the World Health Organization that will be putting out a report on this. And you may have seen, if you follow on Twitter, Hans Kluge, the regional director of WHO, who did actually tweet about 10 days, 2 weeks ago, on this, about saying that he is making it a priority, as are a number of other governments in Europe, in fact. So I think at an international level, it is now getting very much on the agenda, but I think we all need to keep, I think we also need to challenge the people who say young people have nothing to worry about. This is, you know, not many people, young people die. That may be true, but I think we need to constantly reinforce this message. They may not die, but we do know that there are a non-trivial number of people who are left with significant problems.
I would agree. Our group has people, a lot of us have children with it. My 3 children were affected, babies even. Your stats before about students are quite frankly petrifying, because our group is full of people in their 20s, many of whom were highly active, no previous health conditions. So the risks to the public are not in the narrative. It could be any of us.
Anthony and then Christina. Oh, you're still muted, Anthony.
Basically, any organ that has ACE2 receptors can be affected by this virus, because that's where it binds. I was talking to an expert on ACE2 yesterday, and he said, he asked me which is the organ with the highest concentration of ACE2 receptors, and he said it's the testis and the fallopian tubes. And that was interesting because I'd never heard that. Now, we don't know whether the effects there will have any impact on fertility long term, or maybe on the endocrine, the hormonal aspects of, you know, sexual organs, which could underpin some of the symptoms. But you're absolutely right. This is potentially a massive issue, and I'm fairly sure that the Medical Research Council Wellcome Trust and the NIHR, the National Institute for Health Research, will be putting a lot of money into this. I would certainly hope so, but maybe Martin knows more about the European funding side.
Christina?
I just wanted to add to what others are saying, that I just think this is so important. It's not talked about enough, and it's partly, you know, what prompted us to write something on the kind of population immunity strategy, because it assumes that it is fine for younger people to get it, and it isn't. There was a study in the States that showed that 1 in 5 people in their 20s still had symptoms after 3 weeks. I mean, that wasn't that long, but that's, that's 20% of people. And then there's another study I read this week that showed that something like women were like 4 to 1 more likely to get long COVID, even though men are more likely to get severe disease that ends them up in hospital. Women seem more likely to suffer from long COVID. I don't know why, but we desperately need to research this and understand it. It is a new disease, and I think any kind of comparisons to flu are really unhelpful.
Thank you, Christina.